Thank you, Paul, and thank you, Alison, for the invitation. I'm absolutely delighted to be here because I consider technology has a massive part to play in helping people to stay at home longer and safely. You will soon discover, so I might as well declare it now, I am no expert on technology. But then we have a room full of those, so you wouldn't need that from me. And my presentation is all about people. Just initially a word about the United Kingdom Homecare Association. For those of you who haven't come across us before, we're the professional association for providers of home care from whatever sector, local authority, voluntary sector, not-for-profit and for-profit. Our mission and vision is about ensuring that people have a choice of high-quality, sustainable home care. This word sustainable is important. So for those of you not familiar with home care, just very quickly, it's support to live as full and independent a life as possible. It can include personal care, which will be washing, dressing, bathing, and so on, and support with eating and drinking, and other assistance such as help with correspondence, managing finances, accompanying people on trips, doing housework, providing companionship, and so on. It can be by the hour. I'm sure you've all heard about the 15-minute visit scandals, but it's usually by the hour. Or it can be live-in, which is not quite 24 hours, but the carer does live in with the family. It can be paid for by the state. Approximately 70 to 80% of home care is commissioned by the state, or it can be paid for privately, and we don't know, nobody knows exactly how much home care is commissioned privately, hence the rough estimate of 70 to 80% paid by the state. It is typically provided by a regulated service. That's a service regulated by the Care Quality Commission, but there are also self-employed workers and also people, individual employers employing their own personal assistants. So in terms of where we are now, in any given year, about 1 million people receive support to live at home. And there are many more who could use that support. I think the point that Linda made about more emphasis on prevention, in other words, on keeping people fit and healthy and safe at home, is really, really important. About 1,200 people, this of course changes daily, are delayed in hospital at any given time, awaiting community support. That will usually involve home care, but of course it also involves other community health services. This number, deeply depressingly, is going up. It's a 55% increase from May last year to May this year. And there is a lot of work going on, which I'm closely involved in, trying to crack this particular issue. Because we know that people want to live at home until they die. Sometimes that comes across as people want to die at home. I think it's actually they want to live at home until they die. We know that people recover from illness or injury better at home. Professor Crook said earlier, hospitals are very dangerous places. We know that government, NHS, and local authority policy recognise this. And we also know that care at home is usually cheaper. It's always cheaper than care in hospital, and it's usually cheaper than residential care. So, what's the problem? Funding. Linda will be delighted to know I'm not going to go on about funding, but funding is a major issue. It is not the only issue. It is a major one. There are real challenges in the recruitment and retention of staff. Two main reasons for that. One, indeed, is the inability to pay better For the private home care providers, of course, very often the pay for the worker is better, and therefore their retention of staff is better. The other one is something that we can all do something about, which is the public perception of social care, and particularly care at home. The home care workers do the most amazing job, really changing lives, really helping people to live well at home. And they are paid very little, and they also are not recognized by society as doing that role. And one of the things that we are particularly keen on doing is raising people's awareness of the delicacy, sensitivity, and importance of this work and what it contributes to society as a whole. Home care has complex business models. There is a growing demographic need. People are living longer, I'm delighted to say, but they are also living typically with a number of long-term conditions. I learnt the other day that if you have dementia, the chances are you have at least 4 other long-term conditions. As a result of the current environment, there are home care providers exiting the market most months. There are also a large number of local authority contracts being handed back as undeliverable. I really worry about what that does to the people receiving care. One of the key points that's been, I think, been made in every presentation so far is that of collaboration. There is a lack of effective collaboration. People receiving care at home do not care whether it comes from social services, the voluntary sector, the neighbour, or the health service. They want to know that they can rely on it, it's appropriate, and it's sensitive. And yet, we are all involved in organisations that find it really hard to work together. You've already heard about the importance of social care, health and housing working together. I would add to that transport and leisure. People want a life, not a service, as Linda was saying. And we think that Brexit may also have a fairly dramatic impact on social care and on home care in particular. So what do we need? We need creative solutions that complement and enhance, do not replace personal contact. If we are seeing technology-enabled care, and those are the key words, technology-enabled care, if we are seeing that as a way of saving money, then frankly, count me out. It may end up being more efficient, more cost-efficient, and that's great. But actually, this is about the huge potential that technology has to change lives. We need things that are simple to use. If you are needing support of some sort, you don't need to know how it works or why it works. You need to know that it does work, and you need to know what buttons to press or how to make it work. We need things that are joined up or joinable up. There are some really exciting things going on in the technological field at the moment, but sometimes they fall at the gate because they don't link up with something else that the person is using. That is really important, particularly if you are not familiar with technology. And of course, they need to be affordable and reliable. So I'm now going to tell you a little bit about the people involved in home care. So most importantly, and you've heard a lot about people's person-centred developments today, most importantly, people using home care are typically over 70. Some are younger with learning or physical disabilities or impairments, but the vast majority are over 70. They may well be living with dementia. 1 in 6 of us will be soon. They are likely to have several long-term health conditions, as I was saying earlier. They may live alone. They're probably not very mobile or very dexterous. They may be unsteady on their feet, and they are likely to be lonely with all the impact that has on their health and well-being. Their family and friends may well live at a distance. There are lots of clues here about how technology can help. But there's another really important group of people too, who are the home care workers and the home care organisations. That workforce, because you need to know it, are predominantly women. 85% are women. Most work part-time. They are not required to have formal qualifications, but they do, of course, have and display the most amazing emotional intelligence. 2/3 are aged between 25 and 54. There is, in fact, an even distribution of age at the moment across the workforce. They are on the move. It is a busy, busy life for a home care worker. They're often rushed. There is a very high turnover of staff, so people may be new to the field. It's mostly low paid, as I was saying, but essentially these are people, sorry, I should have passed this. These are people who can display emotional intelligence and are deeply, deeply caring. Anecdotally, they are more likely to have a smartphone. The home care worker is more likely to have a smartphone than a computer. I think there's a bit of a clue there. If you're wondering why I'm going on about the workers in particular, well, we roughly estimated that home care organisations spend over 300 million hours per year in people's houses across the UK. So these are people who know a huge amount about the person using social care. And they are in a brilliant position to build relationships and access and insight into people's needs and preferences. So many of you will know this already, so I'll skip through it very quickly, although I do still have a green light. Helping the individual, making information accessible. You've heard already of some brilliant solutions. There are some out there already. They really must work together. Virtual healthcare you'll be familiar with. Helping informed choice. The Care Act, of course, requires local authorities to help people by providing accurate information. But the important thing is that it's accessible to the person who needs to use it, who may not be familiar with working with local authorities. Monitoring and alarms, again, there's plenty out there, but is it communicating with other techniques? Alerting carers, facilitating communication with friends and family, particularly when friends and family are at a distance, and particularly if it's really, really simple. Daily living activity support. I've been surprised at how very little there appears to be of this. And I think that's an area where a huge impact could be made, just helping people to live a life. I have permission from my sister-in-law to mention her situation. She has advanced Parkinsonism. She's lost the use of one of her hands, among other things. And actually getting dressed is really, really difficult. Now, can we not, in 2016, find a way of helping with this, which would protect her dignity and her independence? Maintaining independence and dignity, of course, is what it's all about. Now, again, this is an area where I know a lot of technology is already developed in terms of helping the business, the home care business, information sharing, enhancing collaboration, joined-up services, scheduling, and so on. Record forming and keeping. I must say I was very, very impressed with Professor Crook's model there. I'm doing a lot of work with NHS England at the moment, and one of the things we're looking at is how we make sure that somebody only has to tell their story once. At the moment, very often, they will have to talk to the home care provider, to the social services, to the accident and emergency, and so on. How we can pass that information through with minimal disruption to the individual. And I think we have some solutions there. Submitting bids is something that home care providers have to do a huge amount of. Training their staff and recording staff development. Promotion of their service. And the reporting both to the local authority commissioners, to the private payers, and of course to CQC about evidence of their quality of delivery. But the crucial thing, and this is the theme throughout, isn't it? It must work for the individual. It has to be readily understandable by me and people possibly even less tech-savvy than me. The joining up of the technological solutions is vital from where the individual sits, and they absolutely must be about enhancing the person's life, independence, and dignity. So the question for us all is, how can we all work together to make this happen? How can affordable and understandable technology be developed further? What support will people need, and how do we plan to make this happen? This is, after all about people. It's about freeing up resources to provide better support to people. It must never displace the personal contact, which is so vital to people who use home care. And this is me, so please do get in contact if you think we can work together to make things better for people. Thank you.